Good evening, everyone. Welcome to the Recharge Clinic. We're so excited that you're all here tonight for our talk on women and hormones. Tonight, we have one of our beautiful providers to speak with you tonight. Her name is Rhonda. And so at the end of the event, if any of you would like to schedule a free consultation or ask some questions, we'll be here and available for you to do that. I will turn it over to Rhonda.
I'm Rhonda. I'm one of the nurse practitioners here. I'm glad all of y'all could come and talk about something that's really near and dear to my heart. I'm very passionate about. That is women's health. We really want to dive into perimenopause, menopause, and post-menopause. Things that women experience and what they go through with those things. No one really explains the symptoms. No one really explains what's wrong or gets to the root cause with them. What tonight we're going to do, we're going to talk about what it is. We're also going to tell you some of the symptoms that you may be feeling. And then we are actually going to tell you some things we can do about it to help you get through these things. Most women come into a clinic, our clinic, or a clinic, and they say things like, I don't feel the same anymore. Something's different. Something's off. They can't really put their finger on it, and that's the most frustrating part. They can just tell that something's going on in their body that doesn't feel right. They don't feel the same. They don't feel like themselves anymore. That's generally what they come in for. That's the frustrating part because they can't put their finger on what's actually changed. That's what we're here for, is to figure out what it is, explain it, and then go through it, and what we can do to help you get past all of that. Some common experiences. Patients come in saying that they experience fatigue, have low mood or mood changes. Their moods can be unpredictable. They can have weight that starts creeping up. It gets put on in certain places that has never been in that place before. That's another common symptom. Libido. It absolutely just disappears. That's another common complaint. These things can sound very familiar to you. I want you to know the most important thing is that you're not alone in this. We feel like it is because we don't talk about it enough. We're also told that it's just a part of life. So you feel like you're alone in these symptoms and what's going on with your body. Some of the things we're told. Women come in, what they're mostly told is that it's just a part of life. It's just a part of aging. They give you certain symptoms or certain diagnoses that have nothing to do with the root cause. So that can be very frustrating as well because they don't get down to the root cause. Symptoms don't really get managed and the patient just goes on and deals with what's going on with their body. So that's where the problem starts. We got to get to the root cause. Reality. This is common. It is a part of aging. It's a part of our lives. We don't have to suffer through it. We can treat the symptoms. We can manage them. We can give you a better quality of life. We just have to get to that root cause. There's 3 key phases: perimenopause, menopause, post-menopause. Most women only hear about menopause. That's mostly what we talk about. Really, it can start in perimenopause as early as your 30s and 40s, all these symptoms. So that's the menopause is mostly talked about is because that's where the real chaos starts and stays. Some of this starts much earlier on. Perimenopause, like I told you, it could start in your 30s, 40s, and the fluctuations in your hormones are pretty highs and lows. They could be really high and then all of a sudden really low within a few days of each other. So your symptoms feel like they're all over the place. You could have PMS type symptoms and then a few days later almost feel menopausal type symptoms. The hard part about menopause is catching it lab wise. We really diagnose that a lot with symptoms because you take labs, we draw them, it's just a snapshot in time. Your labs look normal for a premenopausal female. You have all the symptoms of perimenopause. What do we do next? Those symptoms are very unpredictable. Perimenopause symptoms can be irregular cycles, anxiety, mood changes, depression, sleep issues, brain fog. So a variety of things, PMS type and menopause type symptoms. Most women don't connect that to hormones yet. Most physicians don't even connect it to hormones yet. That's where the struggle lies with perimenopause. Menopause is defined very simply: 12 months without a menstrual cycle. Hormonally, your estrogen drops dramatically. And the symptoms often are constant, they intensify. The symptoms that we see: hot flashes, night sweats, weight gain, fatigue, mood shift, low libido. Women are often brushed off, which is very frustrating, especially when I meet with them. They've been brushed off by multiple different physicians, professionals saying, it's just a part of life, deal with it. That's not true. It does happen in life, but you don't have to deal with it. And then you go to menopause. After menopause, hormones stay low. There's no real fluctuations. Those symptoms, the hot flashes, the night sweats, the mood changes, sleep deprivation, brain fog, low libido, they can get even more intense, more bothersome. We can treat them and improve your quality of life. Long-term impact when it goes untreated: low bone density, so it can help improve low bone density if we treat it, increase heart disease risk, and then cognitive decline. That can all be part of untreated postmenopausal females. This is a health issue, not just a comfort issue. Let's talk about something that doesn't get talked about near enough, and that's libido. We keep that on the down low. Women experience very low libido when they go through menopause. They have vaginal dryness. They have pain with intercourse. So we think women are just supposed to accept this because that's part AG. You don't have to accept it. You can actually help these things. And there's some other things too. There could be some thyroid overlap because you start to put on weight when you go through menopause in certain areas that you didn't before. So there also could be a thyroid overlap. Your thyroid levels could be low. Low thyroid could cause fatigue. It could cause a drop in mental clarity or just alertness too. Hair thinning, that's another thing. When your estrogen levels drop down low, you start to have some hair thinning. There could also be some thyroid overcross in that as well. We want to check that too. Most often women are dealing with multiple hormonal shifts, not just estrogen, not just thyroid, it's both a lot of times. The biggest thing too, the biggest frustration I feel like for females and female patients, including myself, is misdiagnosis. You go in, you have these symptoms. Instead, they tell you that you're depressed. They tell you you have anxiety. They tell you maybe you're not active enough, you're overeating. All of these things are contributing to your symptoms. Never really test hormones. They just put you on medications to treat those things, which sometimes that is needed. Those symptoms are real. Hormones could be the root cause. So we need to check those too. Why it's missed is because hormonal fluctuations, especially in perimenopause, they're hard to track in a lab. So that gets missed. Lab ranges are extremely broad. So even though your lab or your level may fall within that broad lab range, it just may be on the very low end of that range and you're having all the symptoms. Again, they don't want to treat it. If you fall anywhere within that range, they say you're normal and misdiagnose it or just leave it untreated. That's when you feel pretty terrible. Something's off, they're not treating it and just say you're fine and everything's normal. Traditional care problems. So the system ends up treating symptoms. Like I said, they give you antidepressant for your mood. They'll give you medication for anxiety. They'll give you medications for insomnia to help you sleep. Quick fixes, they're not a real answer. They don't get down to the root cause. And it really doesn't help quality of life. That's why a lot of this is happening. How we're different, that's the key here. We do things a lot different here. This is what we do. We don't chase symptoms. We get down to the root cause of those symptoms with labs. Also having that crucial conversation with our patient about how they're feeling, what their symptoms are. That's really important too. You want to put both pieces of that puzzle together, what their labs are and then how they are feeling symptom-wise. That means comprehensive lab work, looking at your full hormonal picture, and then building a plan that is specific for, designed for you, because all of us are different. We respond differently. We have different symptoms. So that's how we do these differently. What that looks like, practically, it just means advanced lab testing, not just basic panels, because we want to see deep into your hormones, not just bioidentical hormone therapy like estradiol pellets, testosterone support, thyroid optimization if it's needed. Most importantly, ongoing adjustments. Our bodies change over time. We respond differently over time. Oxidative stress in our lives can change how our body's hormonal fluctuations are. So we want to do ongoing adjustments and ongoing conversations with our patients about how they're feeling on the medication. Not one size fits all. It just doesn't. In closing, I want to leave all of our patients with this, future patients with this. Feeling exhausted, foggy, disconnected from your own body, that's something you don't have to accept. We can fix it. Normal isn't the goal. It is feeling like you're skin. That's our goal here. If that resonates with any of you, make a free consultation with us. Let us go over all of this with you, have those crucial conversations about your symptoms and what we can do for it. Design a plan that's specific for you, that you're comfortable with, to get you feeling better back to yourself.